I am Almaz Negash, the founder and executive director of the African Diaspora Network. I'm so delighted that you're here with us. We are very happy to partner with KBF US for many years. We've worked together with Hafiza, and she's been our champion. And we're very delighted to bring this conversation, which is very timely and very important. The African Diaspora Network is based here in Santa Clara County in Silicon Valley. We've been in existence for 10 years, going 11. We started with this very basic concept, can we bring Africans and Friends of Africa together? And we've done it through a different convening, but the first one being the African Diaspora Investment Symposium. And then out of that, we created the Builders of Africa's Future, the Impact and Innovation Forums, and now our new program called the Accelerating Black Leadership and Entrepreneurship, ABLE is the acronym. Very delighted that's actually going to be focused supporting Black entrepreneurs in the United States. We really are excited, and I'm glad that you're all here, and thank you very much. And I look forward for more conversation. And now I'm going to pass it to Hafiza. Hafiza, it's all yours. Thank you.
Hello and welcome. I am Hafiza Rashid, the Senior Advisor, Communications and Outreach at the King Baudouin Foundation, United States. King Baudouin Foundation, United States is excited to work with the African Diaspora Network to organize today's conversation. KBF US facilitates thoughtful, effective giving to Europe and Africa. We enable US donors to support their favorite causes overseas. We also provide European and African nonprofits with cost-effective solutions to raise funds in the United States through a tool we call an American Friends Fund. We have over 450 American Friends Funds, including the University of Nairobi, the Harare International Festival of Arts, the Magdi Yacoub Foundation, Heart Foundation, and many, many others. These funds save African nonprofits the trouble and expense of setting up their own U.S. public charity. KBF US handles all back office administration, including tax receipts and donor support. So if you have donors in the US, feel free to reach out to me and we'll be happy to help. And by the way, if your organization has donors in Canada, in Europe, or in Asia, feel free to reach out as well, as we have partners that can help you with your donors in these countries and regions. Thank you.
When the pandemic started in March last year, I think the first impression was fear. Fear for the community, fear for the team, fear for funding, the overall terrified feeling that everything was going to go, away. So as a grassroots organization, we are trusted by our community. We are grounded, we work here, we live here. So people come to us for information. And at that time, we didn't know either what was happening. We could read and we could see, but we didn't really understand what was happening. So within the first week, we had already mobilized all community health workers. We work with over 100 community health workers, partnered with the Ministry of Health to educate both the community health workers and our teams on what is COVID first, because a lot of the community members rely on information on grassroots organization to be able to guide them. I think my instinct as a founder was the fear of the community not knowing anything, because I feel like without knowledge, can you imagine what would happen? So things like WASH, which is usually taken for granted in most places, water, for us, water is a big challenge. And then it so happens that water is the one thing that's going to save us. What transpired was clear project work plans were suddenly scenario plannings, where we were looking at projects and wondering if this project is restricted, we are supposed to do activity based, what is going to happen? Because then you have to have a conversation with a funder for you to be able to do what you need to do. But luckily for us, with unrestricted funding, we were able to pivot very fast. We were the only organization that did not close, because two things: we offer essential services, immunization, family planning. We have a Dandelion Medical medical center where we offer free deliveries. We are the ones championing to end female genital mutilation. There is the issue of teenage pregnancies that was arising in our communities because of COVID. So we were at a point where we needed to think strategically. What really matters? Is it statistics? Is it indicators? Or are we going to look at our community? How do we save our community? So we were lucky. We quickly expanded our backpack nurse model to enable us to be able to reach every woman with contraceptives because our men were home. Most people lost their livelihoods. Chances are a lot of women were calling and telling me, when do I'm going to be pregnant in the next, I was like, oh my God, we really need to get contraceptives where they need to be. We really need to get sanitary towels where they need to be. And just the flexibility and the trust of our community actually enabled us. Till today, we've not closed our doors. And Ati, I'm happy to say, like just last year, we had the highest number of contraceptives taken. We did not have one infection of HIV from mother to child in our communities. Until now, we're still pushing on and being open towards pivoting and changing our strategy every time because it's based on what's happening on a day-to-day basis. So that is how we managed to pivot. And we are happy because the trust of the community is what keeps us grounded in who we are. I hope I've answered your question.
Absolutely. That's really wonderful. Especially, we've learned a lot about from everything from the increased labor at home for women to increased violence at home to increased need for contraceptives, all of those issues. So to know that a local organization, because of your so close to the heartbeat of the community, you can pivot and be able to respond very quickly. So thank you for that. Grace, do you want to also maybe tell us a little bit about how in your experience, how you've dealt with creative ways in pivoting during the pandemic instead of, let's say, like a much larger organization?
Yeah, thank you so much, Ati. And of course, as Wendo said, when we heard about this pandemic, we had a lot of fear. First of all, we didn't know what it was. And as a leader of an organization, I decided, first of all, to stop everything we were doing and to start, first of all, to inform our community. As I mentioned during my introduction, we have an SMS platform, which is interactive. So we stopped all education, all the education on sexual reproductive health, menstrual health, and then we have to educate our community what is COVID-19, the symptoms, and of course, how they should protect themselves against that COVID. And I'm very happy because that tool was very, very, very useful because we saw other organizations like Care International, Yezumids. Actually, we had like 10 organizations who came to us who wanted to use our tool because it's a tool which can reach thousands and thousands of people in a second. So that tool was very, very useful during the pandemic because first of all, it's interactive. So beneficiaries could ask us questions and we could see while reading those questions that there was a lot of confusion. They didn't know what it is. There was really a lot of fear among our community, a lot of rumors. So the first thing was to educate. So, and secondly, we had to protect ourselves. My first worry was related to nurses and doctors, those ones in frontline, in public hospitals. So I could see that those guys in some of the clinics, I mean, in rural areas, especially where we work, I could see that those guys didn't have even those protective equipment they should have. So I talked to some of my donors and I'm so grateful because they allowed me to be able to sew masks. And I'm so grateful for the Johnson & Johnson friends because I had to call them and I can see Michael is here. I had to call him to ask him how a protective mask is made. And he really tried to explain me, and we spent like 2 days explaining my people how to sew that protective mask. So we saw those masks and we were distributing them in clinics, in hospitals, in public hospitals, because those were really those ones on the front line, and I could see they didn't have enough equipment. And of course, because of those, some of my donors who are really who were very, very helpful. They allowed me to even sew the PPE, I mean those equipment to protect the nurses and the doctors. So and I'm so grateful for that, because we had to stop making Agateka pads so that we can make a lot of masks, a lot of PPEs, and some of the masks we have to distribute them among our community, but they were never enough. And we have, of course, our priority were those doctors and nurses. And I'm so grateful to all those organizations who really allowed me to make those PPEs and those masks. And thirdly was, of course, to survive. We, contrary to other countries, we never had a lockdown, and which was really scary. And I knew majority of my community don't have running water in their home. So we had to teach them how to build a tippy tap. I really don't know how to explain that tippy tap. It's something very traditional. At least we were teaching them that they should wash their hands many times. So we had to teach them how to build those tippy taps, so that, yeah, in order to help them survive and protect them. And of course, we had to continue educating them how to continue doing business at the same time protecting themselves. For example, we work in an area which is at the border of Burundi and Congo, and those guys were used to cross Congo to go and do their business. And since the border was closed, it was really terrible, because those women were used to just to do business. So we had to teach them to do something else so that they can survive. It was really very tricky. And I'm so grateful for those organizations who really helped me to have some funds, give them some food, because we could see especially children, there was a lot of hunger among children. So that's how I pivoted during the pandemic. And I thank God we survived. Yes. Thank you.
Thank you so much. It's really incredible to see how you've used this opportunity to, although a crisis may not be seen as an opportunity, but sometimes it is, to respond to the community that you're in. So I really appreciate you explaining all of that to us. So now we're going to talk a little bit more about generally your work and how maybe you can tell us a little bit about the challenges that come and the opportunities as well of accessing capital, specifically to scale or grow your work. And for that, maybe if you want to take a stab at that first, Grace, and then we can go to Wendo.
Okay. Yeah, of course, accessing funds, first of all, when you are in Africa, it's not easy. Yeah, it's not easy. That is very well known. Accessing funds is not really easy. And especially when you are a local organization, it's not easy at all, because most of the funds are given to international organizations. And so when you are a local organization, it's not easy at all. First of all, because even though when you try to put in place all those systems, I mean, all those systems you can see in international organizations, it's not easy when you are a local organization. And secondly, maybe it's related to the fact that when you're a local organization, you don't have access to that ecosystem where money is talked. which means we really lack opportunities to accessing to those ecosystems where you can really have access to funds. Secondly, sometimes I think there is a huge gap between how we do understand our community and how donors understand our community. And sometimes accessing to those funds, if we don't have the same understanding of what we really want to do, the impact we want in our community. I can give you an example. Some of the donors, you can see that they are after numbers. But when you are a grassroots organization, it's not only numbers you're looking for impact. And reaching that impact is not easy. You have to put in place tools which will help you to assess, to do the baseline study, to establish indicators, and to know how you're going to follow those indicators so that you may know that you reach that impact you're looking for. And sometimes that costs a lot of money. And that is sometimes people, especially some donors, don't want to hear. They only want numbers. And when you don't, as I was saying, when you don't have the same understanding on how things have to be done, it's not easy to access that funds. Yeah, I can give the word to Wendell. Maybe she's going to complete me.
Thank you. Definitely, I can relate to that as well from my past experience as a leader of a local organization. Wendell, do you want to maybe tell us a little bit about what your experience has been in accessing funds specifically to scale work? Can someone mute?
Megan, can you mute him?
Yeah, I don't think.
Okay, I'll do that. Yeah, Tida, okay. I think it's.
Oh, great. Wendell, so I was just saying, if you want to share a little bit with us about what your challenges and opportunities have been to accessing capital to scale or grow your work.
Thank you so much for your question, Ati, and I completely agree with Francoise. I think that it's very, very difficult for people to understand community-driven approaches. The way fundraising sometimes is made up, it is project-based. So if you're fundraising for water, then it's water. And then water is supposed to show an impact of how it saved so many people. But the underlying problem on the ground could not, maybe it's not the water, maybe it is the lack of time for productive work for women to actually go and get the water. So I feel like our greatest challenge as an organization is communicating what a community-driven approach looks like. Where if I say I'm going to give contraceptives to women in hard-to-reach communities, it also means that I have to do immunization and HIV testing. And the ones who will be come to get contraceptives, and maybe they find themselves pregnant when we do a pregnancy test, and maybe they find themselves HIV positive. There is layers of things we have to do at the end of the day to make sure that both mother and child are safe. So I feel like that is one of the greatest barriers we have, where projects are really cutthroat. It's not the funds are restrictive, so you can't really breathe as an organization. You have to fit into this particular box. I think the second challenge is the ideal of what equitable partnership actually looks like. We found that there is a lot of people will say that this is an equal partnership, and but the reality is, like Francoise was saying, it's about the metrics. I think that people forget that metrics are people. These are people who are our communities. These are our brothers. These are our sisters. We were born here. This is the legacy that we are going to leave behind, and we want to leave our communities better than we found it. They forget that indicators, when we say 15,000 people got water, these are people, these are human beings whose lives are being impacted one way or the other. But if you don't come to Kenya, for example, because of COVID, and you don't trust me as a grassroots organization with your money, and I have a community that trusts me, there's a very, very big gap. So there's no equitable partnership. Even though we speak it, we don't talk it, we don't act it. Lastly, I'm cognizant of the fact that as grassroots organization, we need organization capacity. I'm always talking about the different jargons every single couple of months. Oh, there's a theory of change now. So we need to learn these new jargons every time. I don't know what happened to just plain English. Like, I feel like I have to learn English every time. It's like revolving English. There's just someone sitting somewhere coming up with these crazy methodologies and M&E frameworks, and we're grassroots. Our job is tackling the problems of our communities. I'm tackling the issue of a cultural issue of female genital mutilation, where I'm trying to bring in the boy child to actually say, we do not want our girls circumcised anymore. We want our girls educated. We want our girls to access contraceptives. You will also find that from a donor perspective, they say, but you're a women's organization. You should focus on women. How can I clap with one hand, surely? So these are some of the challenges, and the opportunities are there, because if you look at projects holistically, we actually make more impact as a community. We actually have, sustainable solutions as a community when we tackle solutions from a point where we are asking the community, what do you need? Other than coming with models that have been tried in different areas and saying, Wendo, I think this model works for you. So for me, I feel like those are some of the challenges and opportunities to expand, where funders can be partners with us. I am so grateful that I have amazing funders, including the AVF, BWF, DAC, who ask me, what does your community need? And I go back to our community board and ask them, what do we need to get out of poverty? And they come up with realistic strategies, where today, if you come to Dandelion, you'll be surprised 10 years ago where we were and where we are. Even personally, I sit back and I go like, this is God, because I would never have imagined that a community can change so much because of a community-driven strategy, that they themselves are working towards getting themselves out of poverty. So I hope I've answered your question, Ati.
Absolutely. That was really wonderful. Thank you so much. I think from both of you, we've learned that local leaders know best when it comes to what their communities need. And if funders can galvanize around listening, learning, and supporting local leaders in their journey and what they need for their communities, then we can have an impact that is maximized for everybody. So thank you both for that. So the last question I have before we open this to some Q&A from the audience is, there's strength in numbers, and we all know that, I think. So in your experience, how do you think organizations can collaborate to recover together after the pandemic? And if there's any examples that you may have in which you've had to partner with another organization in your response to the COVID pandemic, or in any other aspects. And if you can, maybe we can start with you, Wendo.
Sorry, Ati, my computer is hanging. Could we go to
Yeah, we can go to Francois. Yes. Do you want to take this question, Grace, and let us know, in your experience, how you can, how organizations can collaborate to recover together from the pandemic? Thank you.
Can you hear me, please?
We can hear you now.
Yeah, okay. Sorry, I think there were some technical issues. Yeah.
No worries.
As I mentioned before, during the pandemic, of course, we worked together with other organizations to fight COVID. And as I mentioned during my presentation, we had other organizations who came to us to ask us if they can use our SMS platform to educate their beneficiaries. And that was really very, very helpful. And of course, we had other organizations who were making soap. So we had to go to them so that they can give us soaps for our beneficiaries at a cheaper price. Which means, of course, we have to work hands in hands. We have to work together to after COVID. As we work together fighting COVID, we have to work together after COVID. I gave an example of there is a project called Gender Equality and Women Empowerment. It's a project it's a program of Care International. And in that program, we work like five organizations, and we do work on the same people. And each organization bring what it does. Like Zakode, we have an expertise in menstrual health, in sexual reproductive health, in economical empowerment. That's what we do in that community. And another organization which has got an expertise, let's say in legal, especially for those women who have gone through violence. So that organization who has got an expertise in legal matters is the one who takes care for those cases of gender-based violence. So that means it's a good example of working together on the same people, and yet at the end we really want the well-being of those community working. Otherwise, I don't think working alone it won't get any success while you're doing something alone in a community. We have to work together so that all our expertise put together can be very useful to our community. Yeah, thank you. I don't know if I've answered your question.
So it is so important to collaborate. I think that you can't live like an island, whether you're a grassroots organization or you're an international organization. We are working with communities, and funders have the capacity to change and make impact at the community level. It doesn't matter whether it's grassroots or the community at your backyard. So we need collaboration. One of the things that I saw was the importance of cross-pollination. For us, working with other organizations or even universities, even though they are closed, we had universities like Kabarak University who are offering services to Dandelion for social psycho support for our team, because we were dealing with crazy numbers of gender-based violence victims coming to Dandelion Medical Center. We are not qualified actually to handle some of the cases, including defilement of children, and this was affecting the team's mental state. So some of the collaboration was the university bringing in counselors to talk to us and also helping the students who are coming, some who are going through such traumatic experiences at home. In as much as we do understand that kids being in school is actually protecting them from so much that's happening at the community level, we did not foresee the level of abuse at the community level for women and children. We did not foresee women. We did not foresee the level of women who are married being forced into female genital mutilation in marriages. So by collaborating both with local partners, local stakeholders, also partnering with foundations like Planet Wheel, Africa Visionary Fund, and going to them and saying, we need help. We need more PPEs for our medical staff. We need to be able to support our communities with food. We need, our teams need social psycho support. I, as a team leader, I can't bear the burden anymore. I need your support. And we even had the one-on-ones with partners and talking to me and I talking to them and encouraging them, because this is a pandemic that nobody would have seen. And the social and the psychological effect it had on me, I could only imagine. I have 5 children. I'm just imagining what's happening to the woman next door, what's happening to the donor, what's happening to the funder. They're people too. So that cross-pollination was such an important part that even brought me so much closer to the partnerships, especially the ones who are open. And bringing these conversations of we're just people, we're just humans, and we're going through the exact same things. If it is gender-based violence, it is across the board. If it is FGM, there's stuff happening here, it's happening some other place in the world. Bringing our expertise, we are known for sexual reproductive health and economic empowerment of women. Other organizations coming to us and saying, can we learn from you? And also cross-pollinating with other smaller grassroots organizations and building their capacity, because we work in a value where we lift as we climb, which is so important for us, because this space I'm sitting in right now, someone else has to sit in this space, and they can't sit here if I don't lift them. So that is the cross-pollination I'm talking about, that actually has pivoted us to the level where I'm sitting on this table as a rural woman, also privileged to be talking in this webinar. So thank you so much for your answer, for your question, Ati.
Thank you so much, Wendo. That was really great. So the first question we have from the audience is from Maseret. And thank you for this question, Maseret. And her question is, how do either Dandelion Africa or Sakode work with complementary parties to avoid duplicating each other's efforts? So this is more about, like, is there a way we can galvanize similar work and similar efforts? So maybe, Grace, you can start us with this, and then we can go to Wendo.
Sorry, could you please repeat your question? Sorry, Ati.
Sure, no problem. Yes. So how do you work with complementary parties, like other organizations doing similar work in your region, for example, to avoid duplicating each other's efforts? Or it could be with other partners that you know elsewhere as well.
Yeah.
I think you're accidentally muted.
Yeah. Of course, we are so many I can give you an example. We are so many organizations doing education on sexual reproductive health. Like in Burundi, we are so many, but I can say in my area, Sakode is alone. But and it's good. Even the Ministry of Health, let's say the Ministry of Health, there is I don't know how to say it now in English. Like when you want to do a health center, you can't put a health center in an area where is another one. Otherwise, the Ministry of Health will not allow you. Which means everything we're doing actually, because there is the Ministry of Health, which is coordinating everything we're doing, and that means you can't duplicate the same action in one zone because the Ministry of Health has got all people who are doing like sexual reproductive health education in Burundi. That means there is always a need of somebody, a body who's coordinating actions. Otherwise, duplicating would be easy. But in Burundi, because we have, like in our expertise, the sexual reproductive health, we have the Ministry of Health who has to coordinate everything going on in the country. That means once you want to establish a healthcare in an area, the Ministry of Health, first of all, has to come and see if there is another health center in that area. That means you can't do something which is already being done in that area. Yeah, so coordination is very important in everything people are doing, so that to avoid duplication. Yeah. Otherwise, it's good to do things when you are many, because I know, like Sakode, we are making pads, but I can tell you we haven't been able to cover all our demand. So if I hear somebody else making pads, that will be fine. But of course, the client will choose which part to use. So it means it's good to give an open place to everybody who wants to do something good, which is useful to our community, because sometimes there is a place for everybody to do whatever he wants to do. Yeah.
Thank you. What about you, Wendo? What is your experience in any opportunities where you're looking at what others are doing to not duplicate efforts?
Thank you so much, Ati, for your question. And I agree with Francoise. Collaboration and coordination is so important in the work we do. Sometimes I hear people saying that grassroots organizations don't want to collaborate. There's so much competition because there's a scarcity mentality, the usual conversations that people have about grassroots organization. But the reality is we cannot afford to duplicate our efforts because the resources are scarce. So we work in collaboration with other NGOs. So Dandelion works in places where nobody else wants to go. We really strive to do that. We are also in CSO networks in all the regions where we work because we want to understand what are the gaps. So if we are offering sexual reproductive health in an innovative way, where we take sexual reproductive door-to-door through our backpack nurse model, who else is doing that in our region? What is it they're offering that we don't have? Can they come on board and work with us to be able to serve at the same level? So that competition is not there because of the collaboration. That is one. I think also the other thing is donor education, what we call the donor education. In our world, we call it donor education, where you'll find the same funder funding 3-4 organizations in the same region on, say, family planning or I don't know, women empowerment. We usually try to bring the funder on board and say, we are 4 of us doing the exact same thing. We want to divide our areas into regions so that we can be able to actually maximize on the impact. Because when you have all this money in one place, and 4 of you are working on the same space, you're actually not helping the community because you're creating a dependency mentality for your community. And that's the exact opposite where we need to be at. So that collaboration, again, I say, and coordination between us, the funder, the community, and the CSOs that we work with has been instrumental in how we have grown within our sector. I hope I've answered your question, Ati. Thank you.
Yes, thank you so much. That is also a really good explanation as well. So we have a couple more questions for this last 10 minutes of our panel. The next one is from Elaine. Her first question is, what are the ways your organizations are able to obtain on-the-ground updates that larger international or government agencies cannot? So I'm not sure either of you can start this, whoever feels comfortable to go first.
I can go first. Thank you. I'm excited about that question. Thank you. And mainly because as a grassroots organization, we have the advisory board and we also have a community board. Our community board comprises of people with disability, HIV, the community that we serve, because they inform whether the project works or not. And they are our go-to people. They are the ones, what we call the deep stick in the car. I guess they tell you, you're going this way, you're supposed to be going this way, and you really need to come to the center. So that is how we get our updates. We're really close and tight with our communities. The transparency and the honesty and the trust with our communities enables us to be able to know whether we are on track or off track. That by itself it gives us so much pride in seeing the impact that is there in the community, because as I said in the beginning, they decide and they tell you, this is how we think we will get out of poverty. This is how we think COVID will not come to our village. This is how we think FGM will end. And if we just follow what they want, we are seeing significant change. And that for me is how we get our updates at the community level. Thank you.
Thank you. I think that's, again, another really concrete example of like how much of a pulse you have on your community and the needs. and the way you respond is always true to the actual needs of the community and not what funder thinks the community needs. Grace, do you want to give us your thoughts on this question? Of, what are the ways your organization, what are the ways Sakura is able to obtain on the ground that larger NGOs or government organizations?
Yeah, first of all, it's because we are able to obtain that information because, first of all, we are a grassroots organization, and we do speak the language. So communication, first of all, is very easy. But when it's possible, because that's what I'm going to say, it's sometimes there are some organizations, especially some donors, who don't allow us to do that. Otherwise, before we even start any project, we go, first of all, to do what we call a baseline study. And that baseline study is when we talk to our beneficiaries what we're going to do. And we collect data actually related to what we're going to do. And when our communities see that from the beginning, they saw us, they're the one who really informed us about that issue, what is needed. And when it comes to implementation, I mean, during the project, it becomes very easy to collect data because they saw us before even the project starts. But unfortunately, that kind of process, some organizations don't like it, which is very unfortunate. Otherwise, when our people have seen us before even the project starts, collecting data, asking them questions about that issue, about, like, let's say, menstrual health, asking the parents, asking the teachers, asking all the community members how girls are suffering. So when the project start being implemented among community, it's very easy to collect data to measure impact because they have seen us even before the project. So what is very different from those international organizations, sometimes they come with projects which are already made, it's like their project was based on those data they read on international data, but they never went deep on the grassroots to see that community, to ask them the real situation. Yeah, and that's the reason why grassroots organizations are able to collect data which international organization cannot. Yeah. I'm sorry, my English is not good.
Thank you. That was really wonderful. No, that it is excellent. Some of us only speak one language, so I think speaking multiple already is an incredible leg up, and your English is absolutely perfect. The next question we have is from Fatah, but there was also a second question from Elaine. Those questions are slightly similar, so I'm trying to, in the interest of time, try to combine the two. So if you both could think about how would you communicate with your funders when a crisis interrupts your ability to implement a project as planned, or generally when there's a crisis, like who do you turn to and how do you respond? So maybe Wendo, you can start with this one.
I think at Dandelion, we are able to communicate directly to the funder when there is a change. We have, as I said in the beginning, you can have a very clear project work plan, and then because of the pandemic or a crisis, you now have scenario planning where you now have to think critically about what are the different variables that can happen, especially now during COVID. But for Dandelion, we were able to speak directly to the funder and explain, this is what we can do. This is what will slow down. This is what has to stop. And we were very fortunate because we had a very receptive, those who didn't want us to touch their money during pandemic, we didn't. And those who were like, do what you need to do because you know best what your community needs, that is how we were able to pivot. And I think that was the turning point of Dandelion in really thinking through equitable partnership, of the turnaround point and the pivot point where others allow you to change and others only expect you to stay. So that is how, for example, that is how I would answer that question. I hope that's okay. Thank you.
Thank you. Yeah, that's really great. Grace, what about in your experience? How do you communicate with your funders when you have to change course and maybe your projects are not going as planned? And generally, who do you turn to when you have crises like this?
Yeah, of course. Yeah, that's partnership. For the partnership to work very well, you have to inform your partner, your funder that you're going to do something. You're going to, your plans are changing. I'm so grateful for those unrestricted funds, those flexible funds. But even though they are unrestricted and they're flexible, it's always good to inform your funder that I was supposed to be educating my community on sexual reproductive health, but because of the pandemic, now I'm doing education on COVID. So, and I'm so grateful because those partners, they even put more money for the education. So that means it's always to inform your partners about the changes happening in the plans. Yeah.
Wonderful. Thank you. That's really, all of the things you said, both of you really ring true to how important it is to fund locally led organizations because of the proximity they have to the community they service and how quickly they can respond to crises and their ability to generally bring maximum impact for the funds that are also deployed. So I just want to take this opportunity to thank both of you for this incredible conversation, for your candid responses, and for allowing us all to learn about how you've responded to the year that has been 2020 and even this 2021. Because of the technical issues, Derek was not able to join us, but Megan has put his information in the chat. So we encourage all of you to look up his work and learn a little bit more about him. And I'll just pass this to Almaz if she has any closing notes she wants to give, but thank you for allowing me to moderate and have a wonderful day.
Thank you, Ati. What a great job you three wonderful women have done. I also want to mention, Ati, that you are in great hand with co-CEO and with Katie. We know Katie. And I think what I have heard from our speakers and even through the chats is, it is not how much we put metrics on what outcomes has been done. It really is about those that we put our trust in, because when you give money, you're trusting the person, you're trusting Wendell, you're trusting Grace, you're trusting Derek, and allow them to have that flexibility that also Grace talked about. We know this because if you make it so strict, the organization doesn't go any further, the programs pretty much tarnish. And we're pretty much talking about the same thing beginning again, in like from, starting from zero. And especially during COVID, flexibility is key. We've learned that. We used to do our meetings in person, but because we can't, we had to pivot also to virtual offering. And that's what it is. Life gives you things that you sometimes feel you don't handle it, but we do handle it simply because we have funders who believe in us. We have a community that we love so dearly, but at the core of what I took, my takeaway today, and I know on May 25, we will have Nancy Reynolds. She's here also participating. We're going to talk exactly where you left, which is the importance of funding grassroots-led organizations in the continent. Because I think what's happening and what we know is large organizations come and then you have intermediaries, and the money that you get at the bottom is become so small, it doesn't even go any further. So I think we have work to do, but I'm also very thankful to each one of you. Hafiza, Megan and I, we will huddle on the next steps and content. We will share the video. We will share some summary and action report. I encourage each one of you, Ati, Wendo, and Grace, send us anything you would like us to share and include in the report that you want people to know, because I think this is not just ADN does amplify people because we believe in people. At the end of the day, it is all about each other and about people and amplifying each other's work. One last thing I want to add, and I think this was to Masarret's point of view, or the question that I think was Masarret. I don't think we are duplicating efforts. I'm actually thinking about collaborating and building that partnership, because how many of us do we need to do this reproductive rights and providing pads to many parts? We're talking about 1.2 billion people. We need many Wendos and many Graces and many of you to make this possible. So I think what we need to do is, when we know Tabitha from our own BAF, incredible woman, Megan just included her link. I would love for you to know her. If you need be, Wendo and Grace, if you don't know her, we like to include it, because Michael from Johnson & Johnson, I saw him here, is also a mentor and a supporter of Tabitha's organization. If there is a way we can bring you together, it's actually great, because you become just so more powerful and more helpful to the community. With that, I'm gonna say thank you, Ati. It's so beautiful to see you all. And Wendo and Grace, thank you for gracing us with your presence and insight today. We will share everything. Megan, thank you for organizing this. As always, great job. Hafiza, do you have some last word you want to share?
Thank you so much, everyone, for joining us. And if you'd like to contact King Baudouin Foundation United States, please visit our website, kbfus.org, where you can find my email.
Well, thank you. We'll include it also in our thing, in our notes and minutes. But I want to just say thank you and have a wonderful afternoon and
Thank
day
you, everyone.
and evening.
Thank you.
Bye-bye. Thank you.